wondering why this topic. And what a lot of us do not understand is when it comes to insurance, insurance is a very key aspect in business. And it's just because back here, at least in Nigeria, where we are, and of course in Africa, a lot of us do not know the importance of insurance. But I'm glad that some of us are now like um, tapping into this and ensuring that we are able to use to make it also sustainable. If you understand the role of what health insurance play in your business, that means it's actually easier for you to for your business to be sustainable. It actually helps also when it comes to even your staff, when it comes to retention, they are able to stay for a longer period of time. So today we are having um, a company that is very dear to us at AE Mobile Group Academy, and from Allmark, by name Mrs. Grace Odigo, and she's the head client relationship officer at Allmark Mainland One, and she's actually going to be taking us through the role of health insurance in enhancing cost management and efficiency in cleaning and pest control business. Like what is happening now? Look at this cholera. Cholera is actually happening in Lagos, and we are getting, I think as of yesterday, we have 17 people dead due to cholera. And one thing you need to understand is our staff are not, they are not safe when it comes to this. Just yesterday, when some of our staff went to work, I was just telling their operations manager, please, you guys be very careful where you are buying food. Be very careful the water you are drinking. Because health is wealth, their health is very important. As much as possible that because we have HMO, it doesn't mean because we have HMO, you want people to die. So, but at the same time, can you imagine if anything happens, you understand, maybe they go to work and anything happens and you are not actually covered because it happened while they are at work, you will have to use your money to pay for it. So what the insurance company actually do is they come in and they are able to assist when it comes to this. So insurance is extremely very important in our industry. And that is why at A Mobile Group Academy, our business clinic is every month, and we bring in professionals, not just in our industry, but professionals everywhere, all the industry, because we service all industry. So we are bringing, today we have Mrs. Grace Odigo, and she is the head client relationship officer, Allmark Insurance. And thank you so much for actually accepting to come on Business Clinic today, because I know from your very busy schedule, for you to say yes to this, we don't take it for granted. So we want to hand over the floor to you so that you can do justice to this topic. And I'm sure everybody is actually online on YouTube and of course on Zoom. They really want to know a lot about the role of health insurance in enhancing cost management and efficiency in the cleaning and pest control business. So thank you once again, Mrs. Odigo, and the floor is over to you. Thank you, ma'am.
Good morning, good afternoon, everyone. Thank you, Ma, for this opportunity. Like earlier introduced, I'm Grace Odigo, and here with me is Abisola. She is a nurse, and she'll be taking us on some areas in this topic, just to ensure that everyone is carried along and the topic is well understood. So first, we'll go to the overview. So I will talk about the plan. I'll talk about our hospital network, then I will go into the topic. Now, Hallmark HMO is a nationwide HMO that has its coverage nationwide. So we are in partnership with about 1,200 hospitals nationwide, and these hospitals are classified under primary, secondary, or tertiary. So for primary hospitals, these are the normal hospitals that everyone have access to. You see, when you buy your health plan, the hospital that you chose, that's what we call primary hospital. Then for the secondary hospitals, they are known as the optical center and the dental centers. While the tertiary hospitals are the diagnosis center, just like example, the clinics and the likes. These are the tertiary hospitals. Hallmark HMOs carries out quality assurance process prior to adding hospital on our network. So before we add any hospital on our network, we first of all supervise that hospital to know if it is up to standard. And sometimes we might supervise the hospital and the hospital is up to standard, but at some point it starts losing its quality. So what we do is that we do a periodic check on these hospitals, and when we find out that these hospitals are not living up to standard, we delete them from our network. And that is why sometimes you will see that, oh, I'm using this hospital, and next time you go there, we are not in partnership with them. So some things happen and we delete them. Sometimes when we find that they are fraudulent as well, or when they don't give our enrollees the premium treatment they paid for, we delete them as well. So going into the topic, the role of health insurance in enhancing cost management and efficiency in cleaning and pest control business. I hope people are hearing me.
Yes, we are hearing you.
Okay.
Yes,
so
please.
We'll start with the definition of health insurance. Health insurance is a type of insurance that covers a whole or a part of the risks of a person incurring medical expenses. So what it means is that health insurance covers either all of your medical expenses or a part of it. And that is why when you check some of the health insurance, the benefits like ours, you see that there are some things that are covered and there are some things that are not covered. And there are some things that will tell you it is not covered in insurance company. So health insurance is covered either a whole or part of it. So we take that risk from you and we bear that risk. So health insurance policy is an assurance which provides immediate financial help in case when any medical emergency arises. It is also a contract between a policy holder and the insurance company, which covers medical expenses that might occur during illness, injury, or accident. So one good thing health insurance does is that it helps you cover medical expenses, especially during emergency. And in a business like yours that you have to deal with chemicals and pests, sometimes emergencies arise because those chemicals sometimes might be harsh and it might be something that will affect your health. So the health insurance comes in because at that point, you don't have to spend out of pocket payments. You know that you are insured, you just get to the hospital and you are treated. It's also a policy assurance providing immediate financial help when confronted with medical emergencies. Just like I said before, during accident, during injury, it helps you to confront those medical emergencies. What are the benefits of this health insurance? One, cost of hospitalization. When you get to the hospital, you paid for your insurance, you get to the hospital. You don't have any business with paying the hospital. All you know is treat me and I go. So you've already solved that problem. The cost of hospital, whether you're going to be hospitalized or you are an outpatient, is not of a business any longer. What you know is treat me and you go. Second is that it helps you tackle medical inflation. Just like we know today, the cost of things is skyrocketing every day. So health insurance helps you. Once you've paid your premium for the year, and you know that you don't have any business with that. When you are in the hospital, whether they are selling paracetamol 100 naira, 200, 1,000, it's none of your business. What you know is that you paid for that year and you get the services that you need for that year, and you get the services that you paid for that year. So whether it is paracetamol is 100 naira, 1,000 is none of your business because you paid for that. So for that medical inflection, you don't have any business with it for that whole year. Another thing it helps, another benefit is that it helps you avoid large medical debt and protect your financial assets. I've already mentioned that before. You don't have any business paying any medical bill. Imagine you've paid for health insurance and you're pregnant. You want to go and give birth, and the hospital is telling you, okay, your maternity, what you are going to pay us for your maternity is about 250,000 or 300,000, and you've checked for your benefits, you are covered for it. You see that for that you protected that aspect. You don't have any business with it. Your finances is protected. You have everything. You don't have to pay that 250,000 because you have an insurance that will cover you for that. Another thing is that it makes prescription affordable and accessible. You have access to medical prescription, drugs, and consumables. All those things are accessible and affordable. You also have peace of mind. When you have an insurance, you have peace of mind because you don't have to pay any medical bill. You are sick, you take yourself to the hospital. You don't have anything with, oh, I'm sick, I don't have money to buy malaria drugs, I don't have money to go and do this x-ray, I don't have money to go and do this scan. You know that you have insurance that is covering you, and you will just take yourself to the hospital. So it saves you, it gives you peace of mind. Health insurance can also help you in cost management. So what one thing health insurance does is that it is a pivotal in shaping the economic performance. So you have your health insurance, your economic performance is high, is you don't have, you're just okay, you are sound, you know these are the importance of health insurance because it helps you to have your cost managed. Another thing that health insurance does is that it helps reduce productivity loss due to illness. What this means is that the issue of this person is sick, he can't come to work, he can't work that day, the whole work for that day is suspended because the staff is sick. You see that with health insurance, you don't have that is reduced because you don't have to think about it. You are sick, go to the hospital, get treatment, treated, come back to work and do your work. And when you have symptoms of some illness, you can go to hospital, get uh, um, uh, um, medications on what is wrong with you, and you don't have to, the work is not suffering, you are not suffering, your pocket is not suffering, the work at itself is not suffering, you are productive, the economy of the company is increasing, your own economy is growing. It also helps you maintain economic stability. You are stable, both the business is stable, the individual is stable, because sometimes when you are sick, there's people that because they are ill, the business is shut down because they don't have the management to handle it. The business is shut down, or this particular staff is ill, and because of that they can't attend to particular thing. And you see that with your health insurance, you are stable, you have that stability. Another point is that health insurance contributes in maintaining social order. What this means is that, hello, can you hear me?
We can hear you.
Yes, we can, ma'am. Yes, we can hear you.
So what this means is that it helps you it helps to reduce stabilizing factor arising from health issues such as family breakdowns and reducing the social your social lifestyle. When you have health insurance, your social health is in order. You can relate with people, you can relate with your staff, you can relate with people around your family members. Another thing is that it helps alleviate fiscal pressure. This means that it can help you find out where you have chronic condition on time, and it will help you treat those chronic conditions, manage them, because health insurance helps you manage your chronic conditions. So when you get this information on time, it helps you manage it, and it makes you live longer and also have good health to manage. What are the importance of health insurance in cleaning in cleaning and pest control business. One, it helps in improving the overall health status of all staff and curbing the spread of diseases. Now, the overall health of the staff is improved. You people, the kind of business you people do has to do with chemicals, has to do with pests. When you know that you have health insurance and you know that you are utilizing what you should use, it helps you improve your overall health status. Also, chemical exposed to can be treated easily. There are some chemicals that you're exposed to, and for the women, there are some chemicals that they are exposed to which will might affect their fertility. So this when you get exposed to these chemicals, it helps you get yourself treated immediately. Some skin, the skin part of it, some chemical that are attached to the skin, it also helps you get treated. It gives you access to meet a dermatologist. It also helps you for injuries incurred while at work. It can also help you attend to those injuries seamlessly. So my colleague Abisola, she's a nurse. I will hand over to her to attend to this aspect so she can explain more on it. Yeah, Abisola.
Good afternoon, everyone. Once
Good
again.
afternoon, ma.
Thank you. I hope you all understand what Grace is talking about. Please, if there are any questions, please let us know.
Yeah,
So,
we can hear you well, so I don't know, maybe if you can actually speak loud a bit. Thank you,
okay,
ma'am.
can you hear me now? Can you hear me now? Can you hear me now, Ma?
Yes, we can. Thank you.
Okay. So I am going to start with the importance for health insurance. I'm sure that she had mentioned in total what we do, what we cover for, but we also want to look deep into it concerning the business that you're in. It's mostly more of chemicals, whereby you use bleach, you use insecticides, you use pesticides to make sure that anything that is a bit out of control in a specific location and they needed your help, you curb it. So the first thing is what we as health insurance do is to improve the overall health status of your staff, covering the spread of diseases. What do we mean by that? After work, there is definitely going to be an exposure of chemicals on the skin that might cause some burns, or to the eyes that will cause irritation, or inhalation, or even a bit of injection of all these chemicals directly or indirectly. So at the end of the day, one might come down with one or two things. Can come down with rashes, can come down with burns, can come down with asthmatic kind of signs and symptoms. So you come to the hospital, and what we do is to make sure that the provider or the hospital that is treating you will treat you in a way whereby you'll be comfortable that at the end of the day, your health status overall, not only the physical health, but also the mental health and also the social health, because we have some specialty that covers all of those things. That apart from the spread of diseases, the feeling of fear or of anxiety would definitely be allayed. The second one is the chemicals exposed. Is there an example for the chemicals that can be quite corrosive, that when it touches the skin it causes burns? I'm asking a question just to know.
Acid. So we have this popular one that they call O4, which really is not really meant to be used in the industry, but a lot of people actually use it. That is very, very corrosive. So we use acid a lot, in our industry. Then we use a bit of alkaline products also, which they are very corrosive. When it touches the skin, it actually forms the skin, and
Yeah,
the skin will be removing.
of course. And getting exposed to it in unintentionally, the first thing to do is to try to wash it off with clean water. Then the next thing is to come to the hospital. Now, it would be very unfortunate if you get to the hospital and someone that is not covered under this health insurance with the rates of these price spikes, the increase, you will notice that to treat burns or to treat all of those kind of little wounds, it is either expensive, or if they try to do it in a cheap way, the person comes back or comes down with infection. And such an infection can, if not managed properly, can get to one's brain and start to cause psychosis. So what we do is to try to limit it. Yes, you can be exposed. We already know that there are so many risks in what you do. But what we do is to limit the prolongment when it comes to treatment. You can get your treatment on time with no cash from you, because you're already with us, your partners with us. You get to the hospital, you get treatment on time, and it does not lead to any infection to the point whereby you start to complain, or you just you start to complain that you're not getting the treatment on time. No, when you're with us, you know that you get your treatment. Any chemical exposure, we treat it on time. And injury that is occurred at work, let's say broken bottles or broken needles or sharp edges, that while working, the leg might be injured or the hands might be injured. You know that when you get to the hospitals that we have, you're getting your treatment on time. But there are some areas whereby, due to the severity of the injuries, due to the severity of the chemicals on the body, you might not have that opportunity to be treated in your primary hospital. So what we do is to refer you to a secondary or a tertiary hospital that we are partners with, that can treat you on time with little to no cost, because you're already with us. So the next slide is, during emergency, we also cover an ambulance service. We have a team, and we also have our own ambulance, whereby any area within Lagos, if you call for us and you need an ambulance at so and so, even in your workplace, we get to your place on time and we take you to the nearest hospital that we are in line with. That will save cost for transportation, and that would also limit the time spent trying to look for an Uber or trying to get to the hospital for treatment. The access to quality healthcare, especially for low income staff, we've created an avenue for equity, in the sense that people that are earning low and people that are earning high, they get the same treatment, but they have their limit. The low income staff, they get the same treatment when it comes to admission. There's the general, there's the private, and there's the semi-private. You have the general ward, but there is a limit to all the things that we do. Just because they are, let's say, for example, the security personnel that you have, it doesn't mean that we should now give them subpar medications or subpar treatments. No, we have hospitals that can take care of them the same way they take care of people that are of a higher professional, of a higher standard. So the next one is the care and management of the chronic disease. The chronic disease we are talking about is diabetes mellitus and hypertension, whereby the medications that you get, for those that are consistent with their medications, we also have a committee that would take the phone number and the address of the individual and send the medication for a month, or send the medication for 2 months, so that the whole process of going to the hospital almost every month, almost every week, would stop, because you have your medications at hand. So the last one is the access to good pharmacy. They go hand in hand. The medication, even as medications like diabetes mellitus medication, the diuretics, the metformin, the amlodipine, or the lisinopril, the vasopril, the medications like that, or even cough syrup. And we notice that the hospital that you're in do not have such a medication. they can contact us and we can give it to you right at your doorstep or close to where you're staying. So if there are any questions, please do not hesitate. Okay, thank you.
Okay, thank you, Abisola. Thank you,
you.
Abisola, for that. So to continue on this slide, we'll have our question section to continue on how the scheme works. So how does this scheme works? One, you first, when you've enrolled, you first thing you do is to
Sorry, ma'am. Can I ask a question?
All right.
Can I go ahead?
Yes, ma'am.
Okay, so because Madam Abisola was saying something like they would drop tablets at someone's doorstep, blah blah blah. You know, can she expatiate further on that? Because I
Okay,
didn't
so
get that.
she stepped out. So for that, what it means is that we have a pharmacy network which works for everyone. So you get to the hospital and the hospital does not have a particular drug and they ask you to buy. So what we do is you don't have to buy. You inform us that I went to hospital and this is this prescription. They asked me to buy these drugs. So we send it to our pharmacy network. Our pharmacy network delivers that drug to you either at your office or at your home. Sometimes they might contact you to go to any pharmacy close to you so you can pick up that drugs. Then for those that have maybe chronic conditions like what's it called, diabetes and the rest of them, what we do is that we deliver to those ones on a monthly basis. So that's for the pharmacy network.
Thank you.
Okay, ma'am. Okay. So, did you get that, ma?
I did. Thank you very much.
All right. So, okay. So, how the scheme works is that first, after you've enrolled, like your company now, people have already enrolled. So, what we did was we first register you people via our link. We share the link. Then, after the link is completed, you submit. Then the ID number is processed by our enrollment unit, and within 48 hours, you get an email address. But most times when maybe we have network issues and the rest of them, and the email address didn't drop, you reach out to us, we usually share it with you. So recently, I think since last year, late last year, we launched our app that we use. So you go to Google Play Store, you download Hallmark HMO app. Once once it's downloaded, you enter your ID number. It takes you to your e-card. You have access to your e-card. You have access to your benefits. Now, with that app, you can know when you are utilizing and when you're overutilizing. You can know what you are covered for. So nobody gets to cheat you. Nobody gets to tell you you are not covered for this, you're not covered for that. So once you're in the hospital and they're telling you you're not covered for this, you just click on your app and you check your coverage and you let them know that I'm covered for this. And if they're insisting that HMO will not treat your that or will not do that, so the next thing you should do is just reach out to your HMO and we will put a call across to them. Because sometimes these hospitals, they might just prove stubborn, they want to make more money. So you reach out to us, we maybe put a call across to them, or if we see that it's not being resolved immediately, we refer you to another hospital. Then for once after that is done, you get to the hospital where you chose, because in the registration link you have access to choose your own hospital based on your location, either your office or where you live. So once you are done with that, you get to the hospital, you tell them that you are from Hallmark HMO, you present your ID number to them, or you present your e-card via your app, and you tell them that you chose this hospital and you want to be using this hospital. So the hospital, they will give you the card and the form and the rest of them you fill, and you can start accessing care. And once that is done, whenever you receive care, they will give you a sheet to sign. That sheet shows these are the things you are being treated, the drugs they gave you. Sometimes they give some people blank sheet to sign. We encourage our enrollees, our clients, not to sign that blank sheet, because most times they add other things to it, and if it is not well checked, we pay and it is affecting that enrollee. It is your own benefit that is your own utilization is getting high, and maybe before you know what is happening, we've overutilized, and you are wondering, what did you do? How many times did I go to the hospital? So you have to let them know that you are not signing a blank sheet. They should write out what they've done, so you can see it and then you sign. Then for people, when you are far from your primary hospital, like you've chosen a hospital and for one reason or the other, maybe the hospital is on the mainland, and for one reason you went to the island and something happened, what should you do at that point? First of all, call your HMO that something like this is happening to you and you want to use this hospital. Immediately we'll check our list and we'll refer you to the hospital close by. And if you don't have hospital in that location, maybe outside Lagos, or you went to the village and maybe in that area we don't have a hospital close by, so what we do is that we tell you to pay. Once when you pay, you should share the receipt with us and we'll do a refund for you. We'll do the refund for you afterwards. Then when you want to change hospital, just reach out to your HR that you want to change hospital. Then they send the mail to us, then we change the hospital for you. Then for your plan, the plans you pull out on is the Ruby plan. And I don't know if you know all it covers, all the Ruby plan covers. I can share that with you. There's another slide on its own. I can share your benefits with you so you can see what you are covered, the amounts that you're covered for, what you are not covered for, and so you can be informed on your benefits so you won't be cheated. You can also download the app, like I said earlier, and you will get to know what you are covered for via that app. Any question?
Yes, there is question. I'm sure maybe if you have any question about, thank you, madam. If you have any question about insurance, I think, please, the floor is open for you. Maybe you are a business owner on call today, and you've always been wondering how you can actually start HMO, having insurance for your staff. Then this is the right time for you to ask questions from them. Allmark is, so we at A-Mobile, we've been using Allmark as our HMO partner for some years now. And the HR is on the call. I think if the HR was on this call, I think I would have said she should actually, talk to us about this particular product, as in how Allmark has actually changed the tone of the way we actually work. And one thing some of us do not understand is when we are talking about structure, part of your structure is also you having HMO also in place. You having your health, a health system or a health scheme also in place for your staff. So my own question is this. So I know that we always have this challenge. I don't know, maybe that has actually been looked into. So sometimes some of our staff, they will go to a particular hospital and they will now tell us that, oh, sorry, they can't accept us. Even though the hospital is actually on the list, but because that particular staff does not go to that hospital before. So sometimes maybe they will go and work on the island. Maybe they are working on the island and they're going to be on the island maybe for like a week. Maybe they're in the hotel. They are staying in the hotel for a week. And any one of them, just maybe developing malaria, now says, okay, let me go to an hospital in this area, knowing fully well that, yes, we have an HMO scheme on ground. Now, sometimes when they get to this particular hospital, what they usually tell them is, oh, sorry, we cannot attend to you because you don't usually use this hospital. So is it compulsory that we register to one particular hospital, or can we use any hospital that are on the list? So if I go to Ibadan, for example, I'm working in Ibadan, and we have a branch in Ibadan, does it mean that if I move now to Ibadan, I can actually go in and use any of the hospital on that list? I don't know, maybe you get that question.
Yes. Okay, so you first of all choose a primary hospital, either where you live or your workplace, or the place you are always, where you are often. So, but when you are leaving that location, you have every right to use another hospital. And like I mentioned earlier, what you need to do is inform your HMO that I'm sick and I'm not in my location and I need to access care. So if you already have a hospital in mind, you can tell us, okay, I'm in so hospital. So what we do is we send a mail to that hospital because your name is not in that hospital. And sometimes, because recently we started using our app and all hospitals are using that app, that's a portal rather. So they want to ensure that your name is there so they can get their payment. So we send a mail to them on your behalf and you get access to care. Another reason why the hospital will treat that individual is if the person does not have his or her ID number with her, the hospital will refuse because we need that they need the ID number to verify that person. So most times you can even go to a hospital that is not your hospital. But if you have that ID number, they can verify, they can enter and see your name. But if you don't have that ID number, how will they identify you? Another reason is that if you go to a hospital that is higher than your plan, they refuse to treat you. And that is why when you are outside the location, let us know. Even if you are going to hospital higher than your plan, we know that we're giving approval, and these people are very sure that their payment is going to come because the approval comes with a code.
Thank you. So what you're saying in essence, if I'm correct, is if any of our staff is actually working on the island, for example, and the hospital on the island, if they need to use that hospital, we need to get in touch with you. Is that correct?
Yes.
So when we get in touch with you, so that you will check the list, so that if we can actually like afford that particular, if our payments actually cover that particular hospital. Is that correct?
Yes. Yes.
So what it simply means is that anywhere we actually go in Nigeria, we can actually use this particular service. Is that correct?
Yes.
Okay, all right. Okay, thank you. Any question from anybody? I know I have Bilba. Bilba, I know I have you here. You always ask about us and you've been wondering, so that by the time you are now start employing your staff, you will know what to do, so that you will know the importance of actually having HMO, as a backup. Office janitorial is here. So do you have any question? Any question, please? Okay, I think we have our HR online now. Okay, Mrs. Adura baby.
Yes,
all right.
ma'am.
Okay, so thank you. So she's actually online. So she is actually in charge of collating all the HMOs for the company. So I think I would let her to actually talk about how this has actually helped us as a company to have HMO, a health scheme in our process. So over to you, Mrs. Badiru. Thank you.
Okay, so thank you very much, ma'am. Good afternoon, everyone. Good afternoon, Oma. Thank you for making the process seamless and always answering us at any point in time. Okay, so since we have been using HMO, it has reduced our costs, our expense when it comes to treatment, all foreseen contingencies when it comes to staff calling that I'm sick, I have to go to the hospital, because when a staff calls you and lets you know that he or she won't be at work because he or she is sick, you as a company you have to show care, show empathy. And one of the things that has helped us even in our retention, on our ways, on the way we retain staff, is because we have put in place HMO. So when a staff know, when somebody is coming in and they know that they have medical facility in place for them, it shows that you care as a company. And Allmark has also helped us so much that by the time I send the number of if I send Mrs. Grace's number to them, they respond in time. We have that seamless process. So it helps in productivity of your staff. if you put HMO in place, it helps in efficiency. You don't have issue with staff calling in, like even faking sickness, because they have to get doctors' reports when they are coming back to show that, okay, truly this person is sick. And also when we have maybe hazard, when a staff is involved in any hazard on site, we don't have the problem of start looking for the hospital, or start looking for who to take the person there, something like that. The person knows where to go to. And something I must commend Hallmark for is that you can make use of their facility anywhere on the island, on the mainland, once you have your ID, because they gave us one ID card like that we did online. You send the link to your staff, they register, the hospital check through the platform, whichever platform they have to check, and the staff is being attended to. So overall, it has helped our productivity and our efficiency.
All right, thank you so much, Mrs. Badiru. Okay, so I have a question here from Debbie. She says, in a situation where the number of staff is not up to the corporate plan number, what would you advise to be done to avoid delay in response when staff go to the hospital and they are registered as an individual? So over to you, Mrs. Ozigo. The question is actually on the chat.
Okay, so whether corporate or retail, the response time is the same. So whether you're a corporate enrollee or a private, a retail enrollee, the response time is the same. The benefit is the same. Where the change is, or the differences are, is on the prices, the premium, because the premium for the corporate is quite lower than the premium for retail. So, but every other thing is the same. The response time, the treatment, even though that for the retail clients, there are some moratorium attached or applied, but it's still the same.
Fantastic. Thank you so much. Any other question online? Do we have anybody, any question? Madam Doyin, can you check the YouTube? Do we have anybody, any question? So that we can actually answer some of this question. And so one of the questions also that I had before this, someone was asking is why must they have insurance, knowing surely well that clients, they don't like to pay in our industry? How can they be able to put these, in the client's prices? So my advice to you is this: during your negotiation, can you please give the clients an option that they can actually have a HMO for the staff, and let them know the reason why they must have HMO for the staff. So what we do at Mobile, that's what we do. We let the clients know. So if you want HMO for the staff, we actually put the price of the HMO, the price, how much the salary they're going to be earning, how much their HMO will be. If they're going to be on pension, we'll let them know this how much, so that the client can know their own liability on a monthly basis. Now, when a client is a client that is ready to pay, it's left to you also. You can actually imbibe the money into the price for the client, so that you can actually have your staff to have HMO. Then what we do also at A-Mobile is after a certain number of months that you have worked with us, because in our own kind of industry, we tend to see a lot of people deciding that they are going like every now and then. So what we do is we have a number of months that you must have worked with us, then you now we sign you up on our HMO. It's only maybe like the managerial position, the supervisory positions, those ones are automatic. So you have to look for a strategy that can actually work for you as a company. So I have Bilba here. Does it cover wage workers for those who are yet to get salaried workers? Is this advisable? So maybe I should explain this to Mrs. Ozigo. So in our industry, we have wage workers, workers that we pay daily. Now, what sometimes these wage workers also can actually have, they can have maybe accidents on site and blah, blah, blah. So now, Madam Bilbra Pro is actually asking, now, if I actually go ahead and do an insurance plan, is it going to cover wage workers? Can it cover wage workers? Because I do not have salaried workers, I have wage workers. So what can be done, to if I have wage workers? How can I cover them? So over to you.
Okay, so for the wage workers, you can actually cover them. So you have to reach an agreement with them, because since they are being paid either daily or weekly, they can leave at any point. So you have an agreement with them, or you can do it in a way that at the end of the month, if you are the one paying from your pocket, it's fine. But if you are deducting from their salaries, you let them know that your salary, since I pay you every day, I deduct this amount of money for your insurance, for your health insurance. So they will be aware that they have health insurance and their money is being deducted from it. If you are paying from your own pocket, maybe as part of the benefits you want them to have, you let them know that they have HMO in case of any emergency or in case they want to access care. And once they leave your company, you inform us that this person is no longer part of you. So we deactivate and replace immediately.
Okay, fantastic. Another thing that I think I can actually add to it, and Madam Ozigo, I think maybe if you can, if I'm wrong, maybe you should actually correct me there. So what I'm thinking now is I'm looking at if you have a wage worker, for example, and maybe you have two wage workers that you use often, or you have like three, you can actually decide that for this month, maybe you now have a project. I'll give you a very good example. So maybe you have a project of like maybe like 1 million. They gave you a project of 1 million. And you're now like, oh, anything can happen on this project. I don't want a thing that anybody will call sick and they'll be expecting that I'll give them money. So what you can do is what you can now do is you will now ensure that you on that particular project, you are signing up maybe like some of your staff, some of the your project workers, that's your wage workers on that particular project. So project A is 1 million. I'm using 10 staff on this project. Now, these 10 staff on this project, I want to make sure that they are also insured. So now the whole thing is you'll be surprised that some of these wage workers, when they know that, oh, you mean that if anything happens to me on site, I'm going to be insured. I'm actually insured. You'll be surprised that some of them might just be like, no, I think I even want to work for this company. It's easier for them to really want to work with you. So you can look at it on a project basis and just sign up. You understand? Maybe the project, you have a project that maybe it's like 6 months, or maybe you have a continuous project, or maybe like you have a basic cleaning that you're always going to do, in a particular space every month. And you know that you're always sending this particular person. Then it makes sense for you to now say, okay, I'll be signing up for one person. So if this one person leaves, I will call the insurance company to call that one to remove their name and put someone else. So it's something that you can actually plan, look for a way to, to actually put it also in your wage staff, So I think that's my whole contribution to this.
Yes, you are very correct, ma'am. You are very correct, ma. So you can equally sign up for, maybe you have a contract, like you said, 3 months, 6 months. We negotiate that. It might be different from our generic premium, so we negotiate that with you for that period. We cover them, and once that project is done, that contract is elapses. That's it. So it's covered. It's acceptable.
Okay, good. So you will pay me for this, so that means I understand a bit of insurance.
Yeah, you did.
All right. Okay, so my question is there any provision for people outside Lagos, especially in Mowe and Ibafo axis? Because it seems many insurance companies don't have good hospitals in that axis. Okay, over to you for that.
Okay, so there are provisions for everyone in Nigeria. no matter your location. So even if we don't have hospital in that location, and once we are aware of it, we onboard the hospital. As also have provider managers. Provider managers are people who manage this hospital. So these people helps to onboard new hospitals, especially when there is a need for it. So it is covered for everyone in Nigeria, no matter your location. And we have hospitals too in Mowe, Ebafo, and the environment. So we have hospitals in those areas.
Yeah, I think I understand what he's saying. So now, what he's trying to say is that some the hospitals in this axis are not they are not as good as some hospitals you have maybe in Ikeja, in Ogba, in Maryland. So I think that's going to be a business for someone that wants to go and start a very good hospital in Mowe, and Ibapo axis, because I think it's all about is the hospitals that insurance company can see in that axis. They are the ones that have actually signed up to it. So, like she said, you can always look for an hospital outside that axis, or you actually look for very good hospitals also in Mowe or Ibafo. I think that's just what I would say. Now, another question I want to ask. This particular your insurance, does it cover the Lagos State hospital?
No, it does not.
Okay. So, because I know that people are always asking me that question, and I'm always like, I don't know. So now it does it, so at least everyone can know now. I think most of the private insurance companies don't cover the Lagos State, because I know that the Lagos State government, they have their own insurance company, that they have their own insurance company that they started.
Yes.
They use for the Lagos State hospitals all around Lagos State. So even if you are in Abuja, because I have some of people on this call that are in Abuja, one thing is this insurance that we're talking about is not only for Lagos people. If you're in Port Harcourt, like I know that corporate cleaners, they have something like that there. Corporate cleaners do have, they are in Warri. No, corporate cleaners, are they Warri or Port Harcourt? Yeah, I know they're in that axis. So corporate cleaners, it's essential that you have try to start having HMO also for your staff. So another question from Shilek's testimony is, do you have hospital here in Ogijo, Ikorodu, that your HMO is covering? Ogijo, Ikorodu.
Yes, we have hospital in Ikorodu. We do have hospital in that area. Yes.
Ogijo. I think she was very specific about Ogijo.
Ogijo, yeah, that's what I'm checking. But I know we have hospital in Ogijo. We have hospital, yes, in that area.
Okay, yes. Okay, so Madam testimony, yes. So there's an hospital in Ogijo for you if you want to actually sign up to also have health insurance. So why did we really bring Mrs. Why did we bring Allmark, to this program today? The reason why we did is because we noticed that a lot of us do not understand. People always ask, why is it that my staff are leaving the company? Why is it that they are always they are not staying? One of the things that makes staff to stay is they want to know that you have benefits for them. What benefits do you have for your staff? It's very, very important. Because it's part of your retention program. How you can be able to retain your, because why? They want to know that you care for them. Yeah. Okay, so another question from Madam Antonia. That is I Andy in Abuja. She says, what hospitals do you have registered here in Abuja, Asokoro? Abuja, Asokoro. So over to you while I'm actually, so Abuja, Asokoro. Can you help us to check if there's an hospital in Abuja, Asokoro?
Asokoro, yeah, I'm checking.
So,
Abuja. Yeah, Asokoro. Yeah, so we have Asokoro District Hospital.
Okay. Any other one? So we have Asokoro District Hospital.
Hospital. Hello.
Yes.
Yeah, I said we have Asokoro District Hospital. We
Yes.
have Family Care Hospital. Yeah, Family Care Multi-Clinics in Asokoro as well.
Family Care Multi-Clinic.
Yeah, we have hospitals in Asokoro.
Okay, so Madam Antonia says that she would like to register. Well, that is I&D Limited. So we'll be sending also to you. So can we have your phone number, please?
Okay, 081
081
76
76
21
21
20
20.
44.
Okay, so I've actually sent that also on the chat box now, and also we'll be sending it on the platform. Maybe what will happen after this call, we'll have you on the platform for today, so that if anybody has any question about insurance, they can actually ask on the platform, so you'll be able to answer them. So one thing we need to understand is insurance, having HMO, health insurance for our staff, and even for ourselves is very, very, very key. This cholera that is going all around now, God forbid if any of our staff is down with this cholera, and they're at work and you need to rush them to an hospital, then what are you going to do? Are you going to be paying out of your pocket? Man, that's crazy. So it's very, 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 it's a very good way, so you need to look at putting insurance in part of your plan, and it's actually part of structure. So when we're talking about structure is not just you want to be working at home. If nobody's there, you want your company to run by itself. Your structure is also about the way you can be able to retain your staff. Yeah, and one of the ways that you can retain them also is having an HMO in place for them, a very good HMO. We have been using Allmark, and one thing you should know at Mobile Group Academy, we will not sell you what does not work. We've not had any challenges with them, and I think we've been using them now for some number of years, and they've been fantastic. They've been so nice, and we've not had any issue. At least some of our staff, I remember even, I think we didn't pay for, I was just telling them, we didn't pay for like 2 months and they were still servicing us. I said, wow, that's just what it is. They were still servicing us very, very well, and which is very, very key to us, because some staff can be very funny. When staff, especially in our own industry, they will just tell you they're always sick. So if they're always sick, tell them to go to the hospitals. Now that they know that there's an hospital that they will go to, you will see that them saying that they're always sick is not. So there's a particular guy that said he was sick. The HR already knows that if that particular guy does not bring the hospital certificate, of course, they no, you won't be paid. So you have to bring the hospital certificate that, yes, you are really, really, really sick. Even when it comes to maternity, before you actually give anybody, maternity leave, let them go to the hospital. Yeah, let them bring the letter. They'll bring the letter, so that you can put it in their file and you can file it. And this is the way you can be able to even look at your staff key performance, part of your key performance indicators, that you can place, because there are some staff that they are perpetual, going to hospital. So you'll be able to know that, what's your problem? Why are you always going to do you have any problem? Because I can see that you go to the hospital like almost 3-4 times in a month. There's something wrong somewhere, and because our own kind of business, it requires us to have HMO. You can't afford not to have HMO. There was a day that we had a cut, so we had an accident on site. But because we had the HMO, the guy actually cut off, the skin, and we quickly applied what they call it, first aid. But the guy was able to go to the hospital later on, just because why we have an HMO in place. And I think how much do we pay per month? HR, Mrs. Badiru, how much do we pay monthly for each staff? I think it's now, before we're paying like 2,000 something, but I think it's now like 4,500 naira, I think, each staff. That's how much we are paying for each staff now. And of course, you need to
Yes,
also,
ma'am.
yeah, is it 4,500 per staff?
Yes, per staff monthly.
Monthly. But prices are going to differ because we have been with them for quite a number of years. So it's how you are able to like negotiate with them, you know. That's what. So 4,500 naira monthly per staff, I don't think it's too much for a staff that is actually ensuring that business actually goes on well. And one thing that we do, some staff will tell us that, oh, they don't want it. We always say that you must want it because of our policy. You just have to sign up to it. Because if you are sick, we need that particular, we need a letter stating that we are sick. And we don't want any staff to say that we don't care. So we care for our staff as much as we care for our business. So I'm sure we've learned something today, you know, about the role of health insurance in our business. And I'm sure maybe some of us now, we now start practicing this also in our business from today. So I want to use this opportunity to say thank you so much to our partner, Allmark. Thank you for having us today. Thank you for saying yes to actually come today to give us this lecture about the importance of healthcare for our staff, for ourselves, and as a business, and how it can actually reduce cost management, because it's going to reduce your cost management. Can you imagine if I think there was a trainee that came one time to our academy and said when they are sick, you know, she's always giving them 5,000 naira. And I'm like, really? I said, okay, so if they are sick 3 times in a month, what do you do? He said, I'll give them 5,000, that's 15,000. I said, that's 15,000 naira in a month. That's a lot of money as a business. It's a lot of money coming out of your business at this time that we know that things are even very, very easy. You don't want to spend that kind of money at any point in time. So it's essential you understand the importance. It's going to help you with your cost management. It will help you with your retention. Productivity level is going to increase as much as possible. So it means that what? Your profits will also increase. Because a lot of us do not know that what increases our profit is a lot. It's not just about people coming in every day. There are several things that increase your profit. It will also encourage your staff that you care. And that is very, very important to everybody. You know, I love when people always like call me to even tell me, oh, how am I doing? So I'm always telling our HR, I said, please make it a point of duty when people are sick, please call them, you know, show a sign of empathy to every one of them. Let them know that the company actually cares for them. This is why they will always see you as a family. They will see your company as a place they want to work, a place they want to come to at every point in time. So once again, thank you all, Mark, for coming. We appreciate you. And we look forward to more businesses together in the coming years. And thank you to you, Mrs. Ozigbo. Thank you, Mrs. Grace. We are grateful for saying yes to coming to actually give us this talk today. And to our pretty nurse, Abisola, thank you so much. We are so grateful for also. I love nurses. They're always afraid of injection, and they'll be giving you injection. Yeah, the ones that are afraid of injection, they will give you injection. So, but I love nurses. I think if I wasn't in this kind of industry, is either I'm actually in the health industry, or maybe I'll go into cooking. I'm always telling my husband, because I'm not afraid of blood. So if I wasn't a nurse or a doctor, or I wasn't an engineer, definitely I will definitely go into cooking. So nurse is one of the things that I always love. I could, you know, actually start. Funny enough, I actually registered to one time to actually go to nursing school, you know, but I just didn't go at the end of the day. So anytime I say nurses, I'm always like, I love nurses. So thank you so much, Nurse Abisola, also for coming. Thank you for all you do for us. individuals in Nigeria, because nurses, doctors, they do a great job. And guess what? Even we ourselves, we cleaners, we are also doing a lot, because our job is very, very important to nurses. If we don't have a clean environment in an hospital, it simply means that those whatever injections that they are giving, they will just be giving, and next thing, people will be taking another diseases home. So our job also is very, very, very important. So we cleaners, we are very important. We pest control professionals, we are very important. Can you imagine going to an hospital and you see cockroaches on the bed bugs on the bed? So it simply means you are getting healed of headache and you are carrying another thing home. So I think to all cleaners in the house now, can we please unmute ourselves and say something great? You know, we are great. We are the best. Can we unmute ourselves and say something great? If you know that you are proud to be a cleaner or you work in this industry, please do me a favor today and say something great. I'm a proud cleaner. I'm very important in Nigeria. Please, can you say something great? Can we unmute ourselves?
I'm a proud cleaner.
Yes,
I'm
sir.
a proud cleaner.
I'm a proud.
Yes, sir.
And I will ensure my best to make my
I'm
environment
so glad I'm a proud
Yes,
cleaner.
so yes, so we are
And I
proud.
love
We are
Jesus
proud. We are
name.
proud. We are
Yes,
proud.
ma'am.
And we shout it out. Yes, we are proud cleaners. Yes, so we are proud what we are doing. We are proud to be cleaners. We are proud to be pest control professionals. So now, to some of us that do not know, so we have our training coming up next week. So we're going to be having a pest control training coming up next week. It's going to be wow. We'll be preparing towards this, and we have several people that have signed up also for this. So it's not too late for you to sign up if you really want to be trained in the industry, to be a professional in the pest control industry. And I always say this: pest control is a game of technology. So a business of technology you don't want to miss next week. And so if you know that you want to sign up, then why don't you just send us a DM on our Instagram page, or you can send us also a WhatsApp. Definitely you will be attended to immediately. And we have a one-on-one also training for next week for the cleaning. So if you want to start a cleaning also, or maybe you just want a particular topic you want to actually get trained. So we have for next week is our training week. So you can actually sign up for any of the courses. So thank you once again for actually joining this call today. I don't take it for granted that you actually joined. And guess what? Have you followed the Cleaners Pest Coach Africa channel today? If you have not, you need to subscribe to the Cleaners Pest Coach Africa. Yes, subscribe to it. And thank you for joining, and see you again, same time, same period.